school positivity rates, masking guidance changes, distance learning status updates for the department's state distance learning program and Kaiapuni programs, expanding COVID-19 testing in schools, and readiness of schools to transition to distance learning if necessary. I will now ask board staff to call on any testifiers who signed up to provide oral testimony on this agenda item.
Rebecca Hadley Schlosser, George White, David Miyashiro. Rebecca, can you hear me? Chair Payne, Rebecca Hadley Schlosser is not connected. Moving on. George White, followed by David Miyashiro. Lorraine Yoshida. George, can you hear me?
Yes, ma'am.
Please proceed. You have 2 minutes.
Aloha, Chair Payne, Vice Chair Uemura, and members of the board. My name is George White, a father to 2 girls that attend private school and an uncle to 3 Keiki at 2 public schools on Oahu, all under the age of 12. You have my written testimony before you, so I will limit my comments to highlight a couple key points. As it relates to Interim Superintendent Hayashi's memorandum and presentation, this board should expect and demand better. At the very least, specific to screening testing in our schools, you as the board and we as the public deserve much more than just a slide with 2 pictures on it. It is undisputed that CDC, DOH, and DOE back to school plans all include surveillance testing protocols and emphasize their importance. DOE has put forward 3 options for testing: OET, ELC, and ICATT, all federal initiatives that provided the test kits and funding to make them happen. Yet we still don't have any form of testing in a majority of all of our schools. As the crisis currently stands with our positivity rates, DOE or DOH should be flooding the schools with hundreds of thousands of rapid antigen tests. Where are these tests? Who has them? Who has what? If we don't have them, why not? And when does the DOE or BOE expect to demand them to protect our keiki? Earlier this year, the state had $30 million and 630,000 tests in storage. What happened to those? The DOE is not restricted or unable to get these rapid tests into all of our schools immediately. And you're gonna need these tests regardless for at least the next school year or for this school year and next. Lastly, hundreds or more COVID cases are occurring each and every week in our school. I urge the board to consider immediately implementing a policy that requires any student or staff on every public school campus to have that has a mobile phone to have the Aloha Safe Alert app downloaded and activated on their device. The Aloha Safe Alert app and its anonymized technology provides precise and rapid contact notifications, which are
David Miyashiro, followed by Lorraine Yoshida, Kalaniakia Wilson, Mara Hansen. David, can you hear me?
Aloha, can you hear me?
Yes, you have 2 minutes. Please proceed.
Thank you. Aloha, board members. Given that there are many complex issues at play for this discussion item, we'll just focus on student quarantines. As you have previously testified, we remain concerned about the lack of standardized information regarding student learning during periods of required quarantine. DOE officials have shared that school supports may include paper packets or access to Google Classroom materials, but it is unclear what the minimum level of support and learning students can expect at any given school. What is the standard of continued learning? Is there equity of access? We believe DOE should collect and report what is happening at each school for the sake of transparency and capturing best practices. Based on DOE's recent presentation to the legislature, the DOE is preparing guidance to schools for quarantine absence scenarios with standard language. We would highly recommend that this guidance also include how schools can ensure continued student learning. Given that a number of students are also having difficulty getting to campus due to school bus staffing issues, perhaps these scenarios could get folded together for better coordination and alignment with providing learning supports. School districts such as Baltimore have provided clear guidance regarding how learning will be conducted under different quarantine scenarios. That includes if individual students have to be quarantined or if it's an entire class, but the clarity is there. In the 30+ pages in the DOE's health and safety guidance and DOH's home isolation and quarantine guidance for schools, nothing is said about what is expected for learning. In my mind, this is a massive omission that must be addressed. Mahalo for the opportunity to testify.
Lorraine Yoshida, followed by Kalania Kia Wilson, Mara Hansen, Vicky Kam. Lorraine Yoshida. Chair Payne, Lorraine Yoshida is not present nor connected. Moving on. Kalania Kia Wilson. Chair Payne, Kalania Kia Wilson is not present nor connected. Moving on. Mara Hansen, followed by Vicky Kam, Burke Burnett. Mara, can you hear me?
Hi, this is Mara Hansen, a concerned parent and former Department of Education employee. Can you hear me?
Yes, you have 2 minutes. Please proceed.
Thank you. I'm calling because I'm testifying because I'm very concerned about the way that the opening of schools was handled this year. I feel that the lack of proper leadership at the top of the DOE has caused a lot of confusion, and nobody knows exactly what's going on at their school because everything's different everywhere. This lack of confidence on the part of parents, staff, and teachers is I think actually the main driver of learning loss and will be for a long time. We know recently there was a Civil Beat article that that pointed out that almost 10% of the student body in the last 2 years has been disenrolled using homeschooling 4140 forms. That's a huge loss. We may never get those students back. Who knows what their education is going to be like? Some of them may get great education, some may not, though. We also know that the interim superintendent and others in DOE leadership have repeatedly cited that a parent survey from last year said only 1% of parents would be interested in distance learning. But it took questioning and questioning over and over and over again to get them to stop pointing to just a few hundred people or students on the wait list for state level distance learning to finally acknowledge that 10,000 students are actually enrolled in various kinds of distance learning. That represents 6% of the student body. So now we're talking about 16% of the student body whose parents obviously are not confident about the safety on school campuses. That is huge. We are now also losing staff right and left. And they also are not confident about the safety on school campuses. We have to implement proper mitigation to do this right, to get our staff back, to get our students back.
Vicky Kam, followed by Burke Burnett, Lucy Herzog, Susan Piccola Davis. Vicky, can you hear me? Chair Payne, Vicky Kam is not present nor connected. Moving on. Burke Burnett. Burke, can you hear me? Chair Payne, Burke Burnett is not present nor connected. Moving on. Lucy Herzog, followed by Susan Piccola Davis. Sarah Hofstetter. Lucy, can you hear me? Chair Payne, Lucy is not present nor connected. Moving on. Susan Piccola Davis. Susan, can you hear me?
Yes, I can.
You have 2 minutes. Please proceed.
First, I'm going to start on the slide deck. Slide 6, distance learning. You know, it's September 16th, and now we're talking about distance learning. And although there's a state distance learning program, nobody has really described it, and it's only for the ones that were first come, first served. I know this will be disputed. On the contingency planning, which is slide 9, there are links. Well, the links aren't linking you to triggers or anything like that. They don't provide any more information than the slide. They don't provide actual triggers for different modes of learning. All you do is click on that icon and you'll get the COVID-19 guidance to schools. Probably the short story they placed on their website. There aren't any indications for changes to modes of learning. I hope I'm wrong, but I say I've been batting 100. Now we talk about cases on campus. As an independent certified contact tracer, and I have attached it to my testimony, I did an analysis for clusters rather than looking at individual cases at schools. That has been provided. I don't need to describe it, but I know it will be disputed. That's okay. Many of our testimonies get disputed. Many of the board members' statements get disputed. That's fine. As long as we're on the air and everybody can hear us, I'm fine. I don't worry about being disputed.
Sarah Hofstadter, Sherry Nakamura, Lynn Otaguro, Diane Tam. Sarah, can you hear me?
Yes, I can.
I can hear you as well. You have 2 minutes. Please proceed.
Okay, I'm a member of Hala Hawaii, which is a community activist group. I'm here on behalf of an educational assistant who is working today and is unable to testify but wanted to communicate her situation to the board. She works 7 classes of at least 22 students each, 2 days a week. And on 2 other days a week, she supports a student who's in a wheelchair in a fully self-contained classroom. She's worried because she learned that there were 2 teachers on her team that had COVID and she was never informed. She is also only given gloves to work with her student in the wheelchair who needs help with eating and toileting. The other day, this student vomited and all the adults in the room felt unsafe without the proper PPE. She is not being offered an N95 mask, even though the Assistant Superintendent of Facilities and Operations says that there are so many masks stockpiled in the schools that they don't even know where to store them. This educational assistant also works in the cafeteria where there are only a few students in the morning. There are markings for them to sit 6 feet apart, but the cafeteria manager told her the kids can ignore those markings and sit 3 feet apart, even though there's plenty of room to distance even more than 6 feet. There is no one cleaning the eating areas, and she was not allowed to even ask the kids to help clean after they're done eating. The cafeteria manager stopped the students from cleaning when they wanted to do so voluntarily. Thank you for allowing me to share this woman's story. I think the situation in our schools right now is abysmal on the ground. There's so much inconsistency in what
Sherry Nakamura, followed by Lynn Otaguro, Diane Tam. Sherry, Hey Coalition Director. Sherry, can you hear me?
Yes, can you hear me?
Yes, please proceed.
Mahalo. Aloha, Chair Payne and members of the board. Sherry Nakamura here, Director of He'e Coalition. We would like to comment on discussion item 5A. As we have stated in our written testimony, David Shapiro's article in last Sunday's Star Advertiser concisely sums up some of the concerns community members have had regarding the opening of schools. He concludes that while schools need flexibility, in a pandemic, we must also have some uniform safety standards across the system. I'd like to illustrate an example of what Mr. Shapiro is talking about. I spoke to a principal in the LA Unified School District. This principal explained how the district was taking care of major health and safety protocols. For example, there is consistent weekly testing at all schools by a mobile health team deployed by the district. I asked what happened to students when they had to quarantine. The principal said that in their sub-district, All the schools use a common learning management system called Schoology, whereby instructional materials are uploaded and students can work independently. This was consistent across schools. I asked about ESSER funding for their school. The principal said that there was an equitable dollar allocation across schools, and they were allowed to use the funds accordingly to address their needs. This principal is using the funds for increased teacher hours to tutor students. While Hawaii is not LAUSD, I wanted to illustrate this example to show that by having a balance of some uniformity across the district, but at the same time allow for flexibility at the school level, execution is inherently strategic. I hope that we can start to move towards this kind of balance going forward in the DOE. Thank you for this opportunity to testify.
Lynn Otaguro, followed by Diane Tam, Brian Costa, Linda Elento. Lynn, can you hear me?
Yes, can you hear me?
Yes, you have 2 minutes. Please proceed.
Aloha Chair Payne and members of the board. At a board training session, the question was asked, what do you do about a gap between the information provided by the department and the information provided by stakeholders? This is a problem because often the two have not matched, and it leaves members of the school community dismayed, even feeling gaslighted, when their experiences are so different from what is reported. Our DOE and DOH say that the schools are safe, but people see alarming numbers of COVID cases in the community, in hospitals, and in our schools. Families are receiving multiple notifications of cases on campus, and children are missing instruction for absences and quarantines. Administrators, counselors, and others are covering for quarantined teachers and staff. Principals are notifying close contacts and sending COVID notifications late into nights and weekends. Students worry about getting sick and bringing COVID home to vulnerable family members. It is disheartening when information has not been shared with the school community on the issues and the steps taken to address COVID. Little information about contact tracing in schools, little on testing, little to explain why, in spite of what people see and hear, that schools are safe. There are conflicting messages on attendance. A parent received a truancy notice that said if they were not comfortable with sending their child to school, it was an unexcused absence, and after 15 days, they could be called into court. Another said it was suggested that they withdraw their child and homeschool. Attendance is important, but it is a core mitigation strategy to stay home when sick. Many parents in this time have few options when they are worried about school safety. To the DOE and the board, to address the gap in reporting, please listen to the concerns and check on them. DOE, answer questions and provide information and truly partner with the stakeholders by sharing information and accepting help. Thank you very much.
Diane Tam, followed by Brian Costa, Linda Elento, Lena Alavetter. Diane, can you hear me?
Yes, can you hear me?
Yes, I can. You have 2 minutes. Please proceed.
Aloha board members, I'm a parent. This is for people who were not at the finance committee meeting earlier. Please consider funding mitigation strategies like surveillance testing in the schools. Those millions of dollars in federal funding in the ESSER funds were intended to make health and safety a priority in schools so that we could safely send our students and educators back onto campuses across our state. So why aren't all schools testing? We heard a principal state that it's because it's only recommended, not required. Parents are asking, why isn't our school on the list? My daughter's school is on the list, but it's only for a one-time pop-up event, not the ongoing surveillance testing that we actually need. Other parents were told first come, first serve. We only have 100 tests. Do they only have 100 students and staff at that school? Yesterday, state epidemiologist Dr. Kemble said that there would be no staffing on site from DOH for the Operation Expanded Testing OET program. That's another reason all schools are not participating, because schools school principals are unable to find staff to coordinate the surveillance testing efforts at their school. We want COVID surveillance testing in schools to succeed in order to reduce the risk to in-person learning. But without the funding of staffing to carry it out, it will be doomed to fail before it even gets rolling. We need staffing and a proactive, coordinated state-level strategy to make testing in schools work the way it was intended to work, namely to be a mitigation strategy per CDC's guidance. Please provide the funding to ensure that staffing for this testing program is covered so that we can successfully implement the surveillance testing in our schools, so that school admins and parents can make informed decisions about the degree of safety that schools can realistically provide to our educators and our Keiki, especially our most vulnerable elementary school Keiki who are still too young to get vaccinated. Mahalo.
Brian Costa, followed by Linda Elento, Lena Alla Vetter, Catherine Matavao, Kaena Elaban Manua. Brian Costa. Brian, can you hear me? Chair Payne Brian Costa is not present nor connected. Moving on. Linda Elento, followed by Lena Alla Vetter, Catherine Matavao. Linda, can you hear me?
Aloha, yes, I can.
You have 2 minutes.
Am I
Please
on?
proceed.
Thank you. This is in regards to just based on a few things that I've read this morning. And I just wanted to ask if the board has similar concerns or a question the following. Based on the news I read this morning, it talked about, I guess, this new testing that's going to be happening at schools. Even though the nasal swab is done here, they would actually be sent to the mainland and could take 3 days to get results. When we look at the funding, the ESSER's funding for this type of process to help with safetiness at our schools against COVID, I think it requires, or at least it strongly recommends that the school follow CDC guidelines, which is my understanding that if any test is done, that it should have results back within 24 hours. So that's my biggest concern. In addition, as a parent, I would appreciate the the distance learning as an option. Because of this concern and seriousness of COVID and the unknown, I'm fortunate. My son goes to a school that has new air. I guess the air in the climate there was all changed, and I feel more secure that he's there. So that I want to say works. And if every student had that, then maybe a lot of students would feel as confident as I do. Thank you very much.
Lena Alla Vetter, Kula Kaiapuni o Maui Ma Paia. Lena Alla, can you hear me?
Aloha, yes, I can hear you. Thank
You
you.
have 2 minutes. Please proceed.
Mahalo. My name is Lena Ala Kulaloyo Vetter, and I am a kumu at Kula Kaiapuni o Maui at Paia. I've also sent my written testimony, but I'm just going to go over some points. I am writing in support of the Kaiapuni Distance Learning Plan and the financial resources that will be provided by the Department of Education to put systems in place to support the necessary functions and administrative duties of distance learning. In-class participation and conversations is the optimal educational environment in a Kaiapuni education. Parents considering a Kaiapuni distance learning program need to consider the major difference of the advantages that their child would be in a classroom environment rather than distance learning. I support the plan and the points that it was presented to this board by the Office of Hawaiian Education. I also like this board to consider that Kula Kaiapuni distance learning program may face its challenges as far as language acquisition and personal connections with each student coming from various islands, moku, and ahupua'a. The social and emotional learning environment of families choosing a Kaiapuni distant learning program need to be considered to also support them in the needs that are exclusive for their ohana. Please consider other funds to support social emotional learning and family supports as well. I'm confident that DOE and BOE administrators, as well as the governor and legislators, will support the financial and structural growing needs in Kaiapuni education that is just as important as public English medium schools in Hawaii. Hawaiian is the language of these islands, and I know that this administration will continue its effort to maintain its commitment to see it flourish. I feel very safe in my school, and I'm very confident in the health and safety procedures that was put in place last year. I am also confident in the students that are coming to our school. Looking at our data, we see that the students coming to our school that are coming back to school, sometimes they're sick, and so we have to send them home right away. Please also consider the emotional and psychological implications that these will have on our.
Catherine Matavao, followed by Kaena Elaban Manua, Osa Tui, Dana Moore. Catherine, can you hear me?
Yes.
I can hear you as well. You have 2 minutes. Please proceed.
Okay, thank you for this opportunity to provide testimony. I am a parent of 2 children in the DOE. My concern is over surveillance testing and why weekly surveillance testing has not been implemented with as long as we've been back in school, with as high as the daily positivity rate has been, well over 5%. There's really no excuse. Contacted my principal and he sort of tersely replied it wasn't. Contacted the complex.
Champagne, Catherine is experiencing technical difficulties on her end. We will provide her an opportunity for late testimony. Kaena Elaban Manua, followed by Osa Tui, Dana Moore, Julie Reyes Ora. Kaena, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, I can. You have 2 minutes. Please proceed.
Okay, aloha no kako, wano kaena alaban manua, himakua wau ma kamakupuni o Maui. I'm a very concerned parent as our students of Kula Kaiapuni Hawaiian Immersion Education has again been left in the dust and forgotten about. I am concerned about the inequality that has lasted for the last 30 years. Our teachers, some of them still are translating work straight from English books. Why do we not have those resources? I mean, on top of that, distance learning. At the beginning, we were told from the start that there was not going to be a distance learning option. So a lot of us Makua did not sign up for distance learning. Now we are about 3-4 weeks into school and still being told that there is no option. We understand that there is no quick fix to a Hawaiian distance learning program, but why hasn't something been started to try to help us out in the meantime in trying to create some sort of distance learning program for our children? My children have been out for 3 weeks so far with little to no learning, and that is due to the inequality of the distance learning program only being provided to the English students. And this is something we're not surprised about. And if you have been following Kaiapuni education, you are not surprised about it at all either. We are underfunded, under-resourced, and we really need some help here. We need some help with a distance learning option for our children, and we need something now. Thank you very much for listening. Ahui ho, malama pono.
Osa Tui, President, Hawaii State Teachers Association, HSTA. Osa, can you hear me?
Aloha, Gina, and also welcome to Dr. Lila Berg to your first meeting.
You have 2 minutes. Please proceed.
Last month, we were indirectly accused during your meeting of dueling press conferences, being unproductive, causing confusion, and of not providing clear and consistent communication. Let me be clear. Our communication has been consistent from the beginning. There are major safety concerns in our schools, a lack of planning for worst-case scenarios. There are inconsistent practices throughout our system, despite the department's health and safety guidance. The system is burning down under your watch as school-level personnel increasingly lose faith that anything will be done by you or by Hayashi. What is it going to take? Hayashi said concerns have to come through proper channels. Do our voices not matter? Does what our teachers say not matter as they are being pushed to and beyond the breaking point? I hope you've read the submitted testimony. It's not just teachers. Page 140 lists what office assistants, EAs, school health assistants, and special services personnel are going through. School administrators speak out after that. Administrators are supposedly one of the proper channels for voicing concerns, so listen up. Employees are overwhelmed and burning out. This morning, the answer was the Employee Assistance Program and informal collegial connections to get through this. The EAP is a maximum 3 hours of counseling services that nobody has time for. Collegial connections are opportunities for commiserating over the disaster that is the 2021-22 school year. Those are laughably inadequate band-aids on the hemorrhaging system and speaks to the tone deafness of this department. The honeymoon is over for Hayashi. It's time to hold him and the department accountable. Hear the voices of thousands of school-level personnel who are struggling in our schools while the department leadership paints a rosy picture and blows smoke you know where. See through the smokescreen and do something. The burnout of school-level personnel is real, and you compromise providing our students what they need when you don't support those who support our students.
Dana Moore, Julie Reyes Ora, Murray Ellsworth. Dana, can you hear me?
Yes, can you hear me?
Yes, you have 2 minutes. Please proceed.
Thank you. Aloha, my name is Dana Moore. I'm a parent and nurse with experience in testing, contact tracing, and case investigation, vaccination, and community education. I have a 10-year-old daughter in distance learning because schools are not safe. Instead, schools are contributing to community spread because parents and teachers are not being notified that students are exposed. Unacceptable. In the DOE's health and safety plan, screening testing should be taking place per the CDC. It's not right that schools are being given the option to participate instead of doing this in every school. About 75% of students in our public schools are unvaccinated. Why should some schools be safe and others not safe? There's a great safety inequity occurring. Without testing, correct tracing, timely notification of exposures, and quarantine, school transmission is occurring silently. It's misleading to tell parents that in-school transmission is not happening and that schools are safe. In-school transmission occurred during the last surge, and Superintendent Kishimoto told parents that there was no transmission. Parents deserve full transparency to make informed decisions. Every school should have a real nurse on campus. Every school needs to be inspected by certified experts in ventilation, public health, and science regularly and periodically to ensure the compliance with safety mitigations required to make schools safe. Until this happens, every parent should have the option for distance learning. Many parents are waiting. The rollout has taken too long for this in-school testing. Some principals are feeling they cannot take on even one more thing, so staffing needs to be provided. We can start with employing the Hawaii Keiki nurses, which are already in place in every complex. Finally, what is being done to make buses and A+ after-school programs safe? Kids are packed on buses too easily.
Julie Reyes Ora, Nanakuli High and Intermediate. Julie, can you hear me?
Yes, I can.
You have 2 minutes. Please proceed.
Thank you. My name is Julie Reyes-Ora, and I'm a math teacher at Nanakuli and HSTA Leeward president. Today, I've submitted a petition from almost 1,000 teachers in Leeward who are demanding collective bargaining. We want to work, keep schools open, and teach students. I'm here to ask for assistance from this board and for commitment from the department to negotiate on working and safety conditions caused by the pandemic. It is codified in our law that we have a right to share in the decision-making process affecting wages and working conditions. The law also maintains that government is made more effective that way. We are being denied the right to share in the decision-making process because the superintendent is hiding behind the governor's suspension of Chapter 89. He might have the authority to shut out teachers thanks to the governor, but he has a choice, and the choice he is making is compromising the safety of students, teachers, and the community. What did an agreement look like with teachers last year? For example, we agreed to COVID response meetings in each school, a limited class size, that lunch supervision needs to be compliant with duty-free lunch periods, We're able to discuss communication, contingency plans, support for teachers, and continuity of learning. Why is all of that such a threat? Everyone is tired of watching what looks like a fight between the teachers and the DOE. Are we going to wait until the school system shuts down? The public should not be subjected to this. It is about defining what is working at the schools and not trying to put teachers in a submission hold during the pandemic. I ask for everyone to support the superintendent meeting with us and negotiate enforceable safety measures and to make the necessary changes that will benefit anyone who walks in on any of our campuses. Schools are our community, and if we're going to get through this pandemic, it will only be because everyone does together. Teachers love the communities we live and work in. We need the board to force the DOE to the table to negotiate in good faith on working conditions and safety issues. We need to think about the future. If the future is what we envision for our schools, what choices we need to make it happen, and how willing we are to commit to those ideals. If this is the future with Keith Hayashi as DOE superintendent, I don't want that future. Working with teachers should never be seen as a threat. Thank you.
Murray Ellsworth. Murray, can you hear me?
Aloha, I can hear you. Can you hear me?
Yes, you have 2 minutes. Please
Uh-huh.
proceed.
Mahalo. Yes, we're about to see a presentation, which I think is not very long, and I think that it should be longer to give us the details we need. I hope that the department will be telling us some updates on masking that include not allowing bandanas and gaiters on campus, because these are not safe masking face coverings. That is not acceptable. Also, we need to have proof that these mitigation measures are being implemented consistently. You're always asking for teachers for proof and data and all this stuff. Where is the department showing the public that there is mitigation measures actually being implemented properly? The stress on the teachers. I am so happy to hear my union president, Osa Tui, saying the stress levels, because I just had news of one of my best friends who is a teacher who has an immunocompromised disease, and she just got tested positive, okay? And she was only in school one day last week, and she had to fight with students in her classroom to pull their mask up, and now she is infected, and she had to get monoclonal antibodies at the hospital yesterday. And I'm just so sad because this is the second teacher I've known that has been infected. And you keep saying that you're gaslighting us, saying it's not happening in schools. It is. Just listen to us, please. I'm so tired of coming to these meetings and nothing happening to safeguard our schools, our kids, our teachers. The notifications, this teacher's case hasn't even been told to the whole school yet. And I don't even think her students, even though she walks around her classroom because she's such a great teacher, I don't even think that all of her students who were in school that day have been quarantined. This is just unacceptable. Please do something. Stop the gaslighting. I'm over it.
Chair Payne, that concludes oral testimony for this agenda item.
Thank you. Thank you to all who testified. We heard you. With public testimony concluded, we will move on to the discussion. And I would like to call on Interim Superintendent Keith Hayashi to provide the department's update.
Good afternoon, Chair Payne, Vice Chair Uemura, and members of the board. Thank you for the opportunity to provide an update on the new school year. The board requested updates on various aspects of opening schools, including continuing education for students quarantining, the vaccination status of employees, COVID cases in schools, masking guidance, distance learning programs, COVID-19 testing, and readiness of schools to transition to full distance learning. Presenting with me today is Deputy Superintendent Phyllis Unibasami. Before I go into the formal presentation of this agenda item, I'd like to address some of the concerns in the written testimony today. We all know that COVID is not going away anytime soon. We need to be focusing our time and energy on working together as a community to learn how to coexist with this virus for the long term. This means learning from the past, building upon lessons learned, adapting to updated information and guidance, and working together to determine realistic solutions that are centered around keeping students in the classroom safely. I fully understand the concerns about workload at the school level. It is hard. Up until a month and a half ago, I was running the second largest high school in the state during COVID. Please know that we are continuously trying to find ways to alleviate some of the workload at the school level wherever possible. For example, I'm working with my team to take a close look at some of the routine responsibilities we might be able to pause for school leaders in order to keep prioritizing health and safety. We're also in talks with partner organizations on ideas to bring in admin support to assist with identifying close contacts at schools. We're looking at what's possible within our policies, rules, and regulations to help mitigate or address workload issues at our schools. At the same time, it's difficult to respond to anonymous concerns because it's impossible to know the context and extent of the problems being raised. I can't address or fix issues if I don't know where it's happening. We do have communication channels for staff to report concerns. I hope those who provided anonymous testimony will share the concerns with their school administrators so that we can take care of any legitimate issues. I would note that I am hearing directly from principals, complex area superintendents, teachers, staff, parents, and students from across the state that although it's hard work, there's a collective commitment to keep schools open and safe so that students can continue to benefit from in-person instruction. There is no substitute for in-person learning, and the social, emotional, and other benefits of students being at school with their friends, teachers, and other caring adults. That's why we're all working so hard to keep our schools open and safe for learning. Moving into the board presentation, starting with slide 2. Slide 2 provides an update on continuing education for students impacted by COVID. Our schools are committed to ensuring that learning is occurring to the greatest extent possible and providing schoolwork to students who are quarantined due to COVID-19. The instructional model and delivery varies by school. Students learning from home due to quarantine will have access to learning through various modes. For example, schoolwork packets designed to be completed throughout the length of the quarantine. Emailed schoolwork designed to be completed throughout the length of the quarantine. Assignment to a Google Classroom or other virtual form of learning and issued an electronic device. Access to school board options for weekly assignments. We are currently engaging with school principals at elementary, middle, and high schools in all counties for a plan for greater consistency with quarantining statewide. Slide 3. Slide 3 provides an update to our employee vaccination status. Increasing vaccination rates within our communities continues to be one of the best ways we can protect ourselves and those around us from COVID-19. This also aligns with the board's resolution and our core essential strategies to encourage vaccinations for all eligible employees and students. I am proud that our employees are doing their part to contribute to the health and safety of our students and school communities. 9 out of every 10 of our salaried employees, or now 90.4% as of today, are fully or partially vaccinated against COVID-19. That vaccination rate represents 19,871 out of 21,978 active salaried employees at our schools and offices statewide. As you'll recall, the department imposed a requirement beginning August 30th that all employees be tested once a week for COVID-19 to comply with Governor David Ige's August 5th emergency proclamation and to provide a safe school and work environment for students and staff. It's important to distinguish that the department is implementing a testing requirement, not a vaccination mandate. If an employee certifies and provides proof of vaccination, the employee is not subject to the weekly testing requirement. At the complex area level, vaccination rates are currently as high as 95% in both the Farrington Kaiser Kalani and Kaimuki McKinley Roosevelt complex areas. Meanwhile, the department's state offices have a combined vaccination rate of 95%. We continue to host vaccination clinics at our schools for eligible students and interested families and employees. In partnership with the Department of Health and health service providers, we've hosted 151 DOE school-based clinics statewide, including one being held at Washington Middle School today with Queens. Our elementary schools stand ready to begin hosting clinics once a vaccine is approved for younger children. Slide 4, please. The department recently began publishing COVID-19 case counts on our website to provide accurate and timely information to schools, staff, families, and the public. Slide 4 provides you with the bit.ly for this website. Our data governance and analysis branch developed an interactive dashboard that displays daily counts by school and office. The dashboard includes confirmed and probable COVID-19 case information from the state, complex area, and school levels. This includes both students and employees. Case counts are visually displayed by date reported and as a cumulative running total of cases since July 1st, 2021. In accordance with Act 4, Session Laws of Hawaii 2021, the dashboard also includes the date each case was reported to the department and the date the positively tested individual was last on our school campus. Data is updated daily, Monday through Friday, prior to the close of business. Daily case counts will reflect confirmed COVID-19 cases reported the day prior. Reported cases that still require confirmation or processing will not be included in the total. Schools continue to make the following notifications for all confirmed and probable cases. Immediate notification to individuals who have come into close contact with the infected person about possible exposure while maintaining confidentiality in accordance with state and federal law. Notification to staff and parents or guardians about the possible exposure and HIDLE activities to contain the spread of infection. The dashboard can be accessed from our homepage at hawaiipublicschools.org. For the next slide, turning it over to Deputy Superintendent Unibasami. Thank you.
Aloha. Thank you, Superintendent. Slide 5 shows what we are doing to manage in-person learning. The department regularly communicates with the Department of Health to stay up to date with the latest information and COVID-19 prevention strategies. As the Department of Health's guidance is updated, we update our COVID-19 health and safety guidance for the field. We recently established standing virtual office hours with the DOH on a weekly basis to connect our complex area superintendents and interested school leaders with health officials. All schools continue to practice the core mitigation strategies set by Hawaii Department of Health in our guidance, which include promoting vaccinations, mask wearing, hand hygiene, and staying home when sick. Regarding masking guidance specifically, our current guidance calls for all students and staff must wear face masks correctly and consistently when indoors at school. The only exception is when eating and drinking. For outdoor settings, students and staff do not need to wear masks in all outdoor settings under the current guidance from DOH and CDC, but most schools are. Students and staff should wear masks in crowded, outdoor settings, or during activities that involve sustained close contact with other people. Students seeking exemption from wearing a face mask for medical reasons needs to complete the request for face mask exemption at school form and submit it to their school. Employees seeking exemption from wearing a face mask shall make an ADA request for reasonable accommodations by submitting the appropriate forms to the principal or to the complex area equity specialist. Accommodations must be made for individuals who cannot wear a mask at school due to medical reasons. Slide 6 gives an overview of our distance learning options. While the majority of our students are back at school in person, we do have some students who are participating in distance learning. The student's parents, and the school administrator work together to determine if distance learning is the best option for the student. Distance learning options may be offered at the school or the complex area or the state level, depending on the school's or the complex area's capacity to offer such programs. Distance learning programs may be synchronous or asynchronous, with or without an online curricular program, depending on the availability of teachers. Whether the class is synchronous or asynchronous, there will be a teacher of record for monitoring and grading. Should a complex area not be able to accommodate a student for distance learning, the Office of Curriculum Instruction Design has developed a distance learning program. We are currently working on a solution for Kaiapuni students given family requests for distance learning. The state distance learning program for grades K to 12 are synchronous and asynchronous. Our enrollment for this program is 625 K to 12 students with no waiting list. For grades K through 8, the K-12 Stride Learning Solutions online program will be the primary instructional program with a teacher assigned to support the learning. For high school, students will have 6 courses in order to earn 6 credits for matriculation to the next level. As with our schools and complex areas, the state program currently has limited capacity due to staffing. Because our focus is on bringing our students back to our campuses this school year for in-person learning, distance learning options across the state are limited. Slide 7. A state distance learning program will also be available for our Kaiapuni programs. Using our leaders from our Office of Hawaiian Immersion and the Kaiapuni principals, they have been developing a design for Kaiapuni distance learning. Currently, our Kaiapuni distance learning plan includes an interim support plan for Q1 and support through the Office of Hawaiian Education for schools who request support and school-designed distance learning programs. The state Kaiapuni distance learning program is expected to open for instruction on the first day of Q2, which will be October 18th. The K-6 program will utilize the distance learning infrastructure that our English medium distance learning program utilizes. The Office of Hawaiian Education is currently working with an ad hoc committee created by the AHA Kaleo to design the grades 7 through 12 program. Some schools have opted to design their own distance learning program to best meet the needs of their students and their program. Earlier this week, we posted recruitment information on our website and social media, seeking to hire full and part-time Hawaiian-speaking teachers and Hawaiian speakers to teach in the Kaiapuni distance learning program. The department remains committed to effective Kaiapuni teaching and learning in our public education system and providing all of our students with equitable access to educational opportunities. On slide 8, the department has partnered with the Department of Health to coordinate school-based COVID-19 testing for eligible students, staff, and school communities at no cost. Expanded testing opportunities will provide convenient access for staff and students as part of the department's testing mandate. By Tuesday, we will have all of our public schools registered for testing. There are currently two options available to schools: the Epidemiology and Laboratory Capacity, ELC, and Operation Expanded Testing, OET. Schools are currently in the process of registering these opportunities and training staff. Once established, testing will be available to any student, staff, or household member that provides the required consent. Operation Expanded Testing is a federally funded program. The program is free and available to the public, to charter and private schools grades K to 12. This is screening testing. Screening testing looks for individual infections in a group, even if there are no reason to suspect those individuals are infected. This is a voluntary testing program. Parents decide whether or not their children will participate. Parents need to sign a consent form in order for their children to participate. Testing will be made available once a week, and if a parent chooses, their children can be tested weekly. Operation ET uses PCR tests. These tests are administered at the school. Samples are collected using nasal swabs and are put into test tubes and sent to the mainland lab. Results are available within about 3 days. So far, 161 schools have registered for OET. 59 of our schools have reported to DOH that they have already started testing. In discussion with DOH, by Tuesday, all schools will have been registered. Slide 9 illustrates the information used by the Department of Health to inform the guidance provided to our schools. Under the Department of Health and Safety guidance for the school year, there are no recommended learning models based on community transmission like there was last school year. This is because the guidance prioritizes in-person learning. Schools continue to be safer places for students, even in the midst of high community transmissions. Schools and community complex areas and state offices have engaged in contingency planning should there be a need for a school to transition to distance learning. As restrictions ease and the Department of Health guidance is updated, we will revisit our current protocols to see where adjustments can be made. We will continue to prioritize in-person learning and will do what is necessary to ensure that our schools are safe for our students and staff. Thank you. Superintendent.
Again, thank you for your continued support. Standing by for questions along with Deputy Superintendent and I, our Assistant Superintendents Heidi Armstrong, Sean Bacon, Brian Hallett, Christine Shaw, Randall Tanaka, Tara Tanimura, and Terry Ushijima. Thank you very much.
Thank you, Interim Superintendent Hayashi and Deputy Superintendent Unibasami. I would now like to open up discussion with board members. Await the first raised hand. Board Member Voss.
Well, if no one's going to start, I'll just start off with something a little different. Superintendent, we all saw what the Los Angeles United School District did last week, what they voted to mandate vaccinations for eligible students 12 years of age and older by certain dates in the upcoming months. So a couple questions related to that. First, does the department have a current estimate as to the percentage of students, eligible students aged 12 years or older that are vaccinated currently in Hawaii's public schools?
Thank you for the question, Member Voss. We currently do not have that information. Out of the 87,000 eligible students in Hawaii DOE middle and high schools aged 12 and older. Yeah, we have not been able to collect that information.
Is the department now reviewing and considering a student vaccination mandate similar to what was created by the Los Angeles United School District last week? And if so, what is the timeline for decision making on that?
Thank you for the question. The Department of Health is the agency that determines the recommendations regarding immunizations. Thank you.
I understand the Department of Health's role, and I think everyone on the board supports that, Superintendent. But I'm looking here at the Department of Education website as to the immunizations that students are required to have in Hawaii. And they include diphtheria, tetanus, pertussis, polio, hepatitis, measles, mumps, rubella, chickenpox, and then at later ages in 7th grade, HPV, MCV, and of course the tetanus booster. Given that those immunizations are required for all students based on science to protect student health, why isn't there more urgency to determine whether and when a student vaccination mandate would be appropriate for Hawaii schools to protect all of our students and staff?
Thank you, Member Voss. The determination or the decision for those vaccinations for our students are determined by the Hawaii State Department of Health, and we do defer to their guidance as the subject matter experts really in health for that. And I do believe that there is a process that needs to be followed for a vaccination to be required for students in Hawaii.
Okay.
Thank you.
Last question, because it doesn't really answer my question at all. Is the department or someone associated with the department at least in discussions with the Department of Health about whether such a student vaccination mandate would be appropriate for our students to protect their health? And if so, when such a mandate would be put into place?
Thank you for the question. Currently, we have not engaged with the Department of Health specifically for a timeline on the COVID-19 vaccination. I will engage them in following this meeting, and I can get back to you in terms of what the process and the requirements are. We do realize the importance of that, and that's how I've come to the understanding that it is not it is the Department of Health's area of expertise in the discussions that I've had with them. But I will follow up with them though.
Okay. I strongly encourage the department to at least have those discussions and investigate the possibility, and if the Department of Health concurs, to act in a prompt manner to protect our student health. I yield, Chair.
Thank you, Board Member Voss. Is there anyone else on the board that has questions or comments with respect to the presentation? Board Member Arakaki, followed by Board Member Fallon.
Hi, thank you for the update. Thank you, Chair Payne. Thank you, Superintendent and others for the update on the reopening of schools. I have two questions. Number one, it was mentioned that the testing for campuses, all of the schools will be done by Tuesday. As far as implementation and testing that is being offered, does the schools have resources or enough support to be able to do what's needed to accomplish that component there? And also, there was mention about a plan just in case schools need to go to distance learning. And is there a threshold of when a school needs to shut down, or the number of cases in the classrooms where they are required to quarantine the whole class, so that it's consistent as far as what the schools are doing within the state if something occurs?
Hello, Member Arakaki, thank you very much for the question. I'm going to turn the mic over to Deputy Superintendent Onibasami. Thank you.
So aloha, Board Member Bill Arakaki. The first thing is I do want to clarify, and sorry if I wasn't clear. Our schools will be registered to be eligible for testing and receiving testing kits. It will not mean that they will have started testing. There is a process in which they need to get consents from parents, and also then use that information in order to then ask for the testing kits. We know from experience that the testing kits come pretty quickly, but getting consent from parents may be our longest time that we need to make sure that every parent is informed and has an opportunity to sign up. I'm sorry, I can't remember the second part to your question.
Yeah, it was
The
mentioned that
trigger.
the contingency plan in case we have to go
Yes.
distance learning is the
Okay.
trigger. Yeah.
Yeah. So we, in conversation with the Department of Health, have talked about what might be a trigger, and what are they looking for when they look for clusters, when they believe that it becomes unhealthy or unsafe for in-person instruction. And what we were told that was that we might be looking at, and this is an approximation, not a firm number, is about 20% of confirmed cases in a class.
Okay. Yeah, thank you for the clarification about the testing, that registration will be completed, and the logistics of parent permission and others to that is a probably a long process too. So, and as far as the trigger rate for 20% within the classroom and area is thank you for that information.
Excuse me, but Board Member Arakaki, you also had another question regarding the capacity of the schools to handle this. I believe that was part of your questioning.
Yeah, so I guess upon completing the permissions and the logistics of testing, will our schools, with the added things that principals and everyone else on campus needs to do, is there supports and other organization or whoever can support this being done once things are completed?
So thank you for the question. So to be clear, this is added responsibilities that are at the point of where our students and our employees are interacting. And so for that reason, I do want to say that it is a real challenge for us to institute school-based testing. However, there is a commitment to do so. In talking with school leaders, there's different ways that we're handling it. There's volunteers. There's also use of our Hawaii Keiki nurses. In fact, in some of our areas, we are seeing schools centralizing testing. If the schools are nearby each other, they're actually centralizing the testing operations so that several schools can access one area, one facilities. We also have approved the use of casual hires to help the school leaders to set up testing teams for their schools as needed.
Yes,
But it
thank you
is
for
a
that.
challenge.
Yes, thank you for that consideration because, hearing testimony from employees, teachers, and HSTA regarding the anxiety and stresses regarding safety on campus is, it's really growing and things. So to consider not overloading you folks is a real consideration that needs to be worked on. Thank you.
Board Member Fowler?
Chair Ping, I'm sorry, Chair Ping, may I also,
Go ahead.
thank you. I'd like to also go back and address Member Voss's question related to vaccinations. Just to be clear that we are in discussions with the Department of Health. We are requiring vaccinations for our student athletes, full vaccinations by 824 or a medical or religious exemption, because athletics, as being one of the extracurricular programs and not part of the core curriculum, it being a privilege, allows us the means from which to require that vaccination. So in our discussions with the Department of Health, we have implemented a vaccination process for our student athletes by August 24th in order to participate in athletics. I'm sorry, September 24th, for our students to participate in athletics. That's in consultation with both the Department of Health and our Deputy Attorney General. Thank you very much.
Thank you, Superintendent. Board Member Fallon?
Thank you, Chair. Just to add a couple of things, I'm really concerned about what's happening to students during quarantine, but taking a step back around kind of the impact of COVID to workload and teaching and working conditions and students and student learning. I believe wholeheartedly we want to do everything to keep schools open and minimize the need for any kind of pull out off campus or out of the classroom, whether it's distance learning or some form of closure. Related to the testing and how it would impact, what impacts it would have, while once a test is administered, assuming you get all the voluntary consents, it takes about 3 days. So what happens to the student during that period of time until the test results are available?
Thank you for the question, Member Fallon. I will be turning it over to Deputy Superintendent Onibasami to address that question. Thank you.
Thank you for the question. There's two different scenarios, maybe three, in which we would be looking at using the test kits. One is a weekly, we're checking different populations, and it's more surveillance or screening. And in that case, the student would and employee would continue to work, because what we're doing is we're just asking to test them weekly. In cases where we believe someone might be ill or they believe they might have been exposed to COVID, we would be looking at testing them at that point in time. It would also then depend on the vaccination status of the individual and determining whether or not they were showing symptoms of COVID. In cases where they are vaccinated, they would be able to continue to work given the guidance we've been given. However, if they are having any of the symptoms of COVID, we would want them to go home. Thank you.
So specific to students, they, when tested, unless confirmed, would be allowed to attend school.
Again, depends on whether or not the situation under which they got tested. Because if it was just the weekly screening that the parents agreed to, they would be able to continue learning until we knew that there was a positive test. However, if the student was referred to the health room or for testing because they were showing symptoms, we would ask that they be sent home.
And that clarity of the different options or situations is something that I guess the principals and school level staff understand.
I
There
believe
might be confusion and because it's all part of that well, at this school they do this and at that school they do not. And then we've heard some of the testimony today as part of kind of that overall environment. So I was just trying to get clear about what the kind of the details are. I understand that sometimes it's situational, but we just need to kind of get some clarity, at least for me, about what is the understanding and the expectation around testing.
So Laha, yes, and just know that there is training once the school registers. There also are different scenarios that the schools may decide that testing will be instituted. So there's the weekly, there's in cases where they suspect that a child or an employee might be sick. And then there's a third one is that they want to conduct an event or some special occasion in which they want to use the testing as a point of reference for making sure that their students or their employees are healthy and able to participate in an event. So those are the different ways in which the schools, there's a lot of latitude for how they use the test. Currently, what you might be hearing and experiencing is that as schools have gotten the tests, they have been using it to help staff meet the governor's mandate if they are not fully vaccinated. And so what you're seeing is an attempt by schools to support their staff members so that they can continue working. But in the down the road, as we scale up and they become familiar with the processes, we will see that they will expand to other parts of their school community.
Okay, moving on to the point at which a decision is made that the student needs to quarantine. Is that what role does a parent have in that decision-making process? I'm assuming that if the case is confirmed with a test of some kind, that the student has to quarantine, correct?
Thank you for the question, Member Fallon. I'll be turning the mic over to Assistant Superintendent Heidi Armstrong.
Okay, maybe what I should do is kind of give you the rubric of questions around this issue, because it kind of centers around what happens to students when they quarantine, and kind of at what point, you know, is the impact so great because so many students are quarantined that it leads to other options. So the next part of my question is, assuming X number of students have been confirmed and they're quarantining, and those who are in contact with them also have been asked to quarantine, how do you know how many are impacted at the school? And does that relate to attendance? And if it relates to attendance, wouldn't you have those numbers available that might be made available so we all kind of understand that it's more than just how many have been confirmed, but it's also the impact to the broader school community, because it has many tentacles. It affects the workload, because now teachers and staff are having to not only focus on the in-classroom students, but provide supplementary materials. So that's another part of the question, the numbers and how that's calculated and available. And then the second, and how it relates to attendance. And then the third part of it has to do with your slide on the educational supports that are available to students. Is there some kind of minimal expectation that you have about what should be provided, or specific guidance that every school should be looking at in terms of Because if on one level, if you're counting them as being in school as part of attendance, there should be some expectation or clarity about what should be provided to the students. So I yield and I give you opportunity to respond. Thank you.
Thank you very much, Member Fallen. Assistant Superintendent Heidi Armstrong will address part of the question, and then Deputy Superintendent Une Basami will address another part of it. Thank you. A.S. Armstrong.
Sure, thank you. And so when a student has been exposed to a case in the classroom and identified as a close contact, they are put on quarantine. And the departments realize we want to have a way of capturing the students who are out of the classroom due to being on quarantine versus being out for other reasons. And so earlier this week, a memo did just go out and a system has been set up in our Infinite Campus, our student information system, where when a student is out on quarantine, there's a special marker that allows the school to see that these students are absent, but they're absent due to being on quarantine. And that allows the school to determine how many students or have an overall view of how many of their students are out on quarantine in order to facilitate planning forward. So that marker has just come out in our attendance system, so we will be able to track those students who are out on quarantine.
And does that include both confirmed as well as those who have been in contact?
Yes, if a student is out due to COVID, they are marked accordingly. So we'll be able to track the absences that are due to COVID versus the absences that are due to other reasons. Now, the marker just came out, so we're not, at this time, our attendance that's been captured from the start of school will not reflect that, but moving forward, we will have this capacity.
Thank you, A.S. Armstrong. Deputy Une Basami.
Yeah, so as I understand, the question is about students' continued learning during quarantine. And basically, there are different various modes that can be utilized to have continuation of learning. Of course, if a child is truly sick, it is not an expectation that they struggle through their learning, but that we want them to get well again. However, if a student is not experiencing symptoms and or is considered a close contact while quarantine, then we have given options to the schools for consideration in thinking about how to continue extending the learning while at home. Those include using Google Classroom, releasing the devices and the Wi-Fi hubs so that the student can take it home with them, whether it's that day or the next day. There's work packets that can be designed for the grade level or for the classroom work. We also know that we have the choice boards that were actually created last year and can be utilized at home by the student and the family that is tied to the standards and to the core content areas. So we do try to give a multitude of choices. And the reason for that is, given the home condition, we're not sure about everything that's going on at home. If others are sick and so forth, we want to make sure that it's not a one size fits all, that in terms of how the student can access their learning opportunities. Thank you.
So my understanding then, based on what you said, is a parent and a student can expect a school packet, either in hard copy or emailed. The term you used was choice boards, e-school, an electronic and an electronic device. Those are minimal expectations that a parent can expect.
Member Fallon, yes. This is Keith Hayashi. We are currently engaged with school principals, engaging with school principals at elementary, middle, and high school through our Leadership Institute to bring principals together to look at the different strategies that are being used when students are in quarantine to bring greater consistency statewide.
Great.
From those discussions, the minimum expectations will be set. Acknowledging the fact, though, that in different communities, there are sometimes different challenges, specifically relating to being able to access the internet or access the network, not because of an absence of a device or an absence of a Wi-Fi, for example, but absence of signal in that particular area. So we'll be trying to set consistency statewide. We will be setting consistency statewide through our principals and through the Leadership Institute, but at the same time acknowledging the fact that no two communities are exactly the same. Thank you very much.
My last question. What about teacher contact? Is there kind of a expectation there in terms of frequency or, ability for parent to contact the teacher, or what are your thoughts there?
Thank you. Yes. I know that our teachers and our school administrators value the communication between parents and teachers, and that opportunity for parents to touch bases with teachers, I believe it has been there and always will be. I know teachers being the professionals that they are, and in working to build a collaborative relationship with parents in supporting the needs of their students with the support from school administrators, definitely is a must, and that communication is always one of the most important things in building a strong student, school, and family relationship. Thank you.
I have so many questions, but I yield because I know there are others that have questions.
Thank you. And before I call on the others, I just wanted a follow-up on the testing in the school, Superintendent, concerning the tests that you are using require 3 days and a trip to the mainland for results. I'm just wondering what went into the decision to choose that as opposed to the more rapid alternate test that is also fairly widely available in the community.
Thank you, Chair Payne. My understanding is that in working together with the Department of Health, DOH looks at the kinds of tests that are, one of the things that they look at is the kinds of tests that they're using, and the accuracy of the test, I think, is also important. So for that reason, and I'm not really sure about the different kinds of tests. That's kind of outside of the area of my expertise, but I do understand that certain tests that are recommended or that are approved are the tests that are being used versus just tests that an individual could go to a store and purchase, and so the consistency there so that we can assure the accuracy of the test. The Department of Health has been great partners in helping to support us with identifying that and initiating contracts for our schools to be able to use. And so the current 3-day turnaround is what currently is. I do believe that the Department of Health is trying to secure a local vendor, which will definitely cut down the turnaround time of the test. So currently 3 days, hopefully we can cut that down significantly. Thank you.
Thank you. My question really reflects the concerns that folks have about the 3 days, because if someone is infected and that delay is significant in the amount of contacts that could occur. Okay, I see first Board Member Nama'u, followed by Board Member Asher, and then Board Member Fallon again.
Mahalo, Board Chair. Go ahead.
Sorry, one more thing that came to my mind. I believe also that for tests to be validated, it needs to be validated by, I believe, what's called a CLIA laboratory. And I think those laboratories, to get that CLIA certification, must meet certain stringent requirements. I'm not sure. I'm sure that there are labs in Hawaii that have that certification. I do believe, though, that with the current testing that's happening statewide, in response to community need, CLIA labs may not be available. And so, but I do know that the Department of Health is definitely working on that as partners in that with us. Thank you. So, sorry for the interruption. Thank you.
Go ahead, Board Member Nama'u.
Okay, mahalo, thank you. I kind of want to address 3 or 4 issues here, and thank you, Board Chair. You were asking, that particular question was one of my questions in regards to, I think in testimony we heard it was like an ICAT or a rapid testing, and I wanted to know if more of that was going to be available to the schools to use, but it sounds as if with just what Superintendent Hayashi just explained, that that's probably or may not be an option. But should it become an option, I'd like to see that the schools perhaps utilize that as a resource, as a tool to handle COVID outbreaks, or to at least identify COVID situations. So I'm hoping beyond the other 2 tests that they can use all kinds of things to continue to use whatever might be available. And as science conducts itself and makes things, the tools become available for our uses, that the school will continue to look into these options and to try to use them so that they can identify situations on their campus as soon as possible. I wanted to ask if, just to get clarity, of the 2 types of tests that are these federally paid for, and that there are no costs at all to the schools, that there's funding that is the testing kits that are coming to the schools, are they being federally paid for and not a part of what the funding that the schools have to pay for themselves out of their own budgets?
Thank you, Deputy Unibasami.
Aloha. So to clarify, ICAT, increasing community awareness around testing, is really something that we ran in the summer. And our provider was CVC, or commonly known here in Hawaii, Long's Drugs. And that will sunset, was supposed to sunset at the end of summer. And we actually got an extension to the end of September. It is a federally funded program, as is ELC and OET. It's all federally funded, and the testing is free, as well as analysis. However, as Board Member Arakaki pointed out, staffing our testing opportunities, there is a cost in terms of who we're using to help with test administration. So just know that while the testing itself is free, and the analysis, not necessarily the staffing of the event. In working with the Department of Health, they have been the lead in terms of accessing the federal funds for school-based testing. And we are looking at closely at when the testing, the project sunsets, the funding sunsets, and the opportunity for the next funding source of for school-based testing. Our job is to really, as we work together, is to ensure that there is little disruption as we transition from one funding source to another funding source. But our goal is to try to keep the funding sources from the federal government around school-based testing, our ability to have access to it so that it's not something that we're using instructional funds or the ESSER funds for, and that we can keep more flexibility with those funds towards the things that we would desire collectively for our students.
Mahalo, Deputy. I'm also pleased to, I'm hoping that the schools will take the opportunity to assist staff in fulfilling the tests that they need in order to take care of the mandate. So hopefully this will be something that will alleviate some of the anxiety for staffers.
Yes, and know that of the schools that that I've been able to talk to, or and the complex area superintendents, that many of our schools started off with supporting staff to meet the governor's mandate. But then they do know that the focus of the federal funds, when we look at the project specs, it was really focused on students. And we also asked that it include our employees, because we knew it was the whole school community, not just one particular part of the population. Thank you.
Yeah, we need to test everybody because everybody's together at the schools. So that's good. One regarding masking, I heard the testimony about gaiters and bandanas. Is there, when it comes to the masking, are there specifics in terms of the types of masks that are agreeable on campus? Or should we put into place some restrictions on certain kinds of masking that some people might think is appropriate, but is probably not, safety-wise?
Thank you for the question, Board Member Namau. I'm going to turn it over to Assistant Superintendent Heidi Armstrong, A.S. Armstrong.
Oh, hi, good afternoon. Yes, our masking guidance clearly states in our handbook that masks must always be worn correctly. And there is information in our health and safety handbook, and I'll read it to you right now about the wearing of masks. The gaiters are not allowed, the bandanas are not allowed. And on page, let's see, 8 of our health and safety guidance, the guidance is very clear that the mask should have the 2 layers of cloth, should fit snugly, covering both mouth and nose. We are asking that we teach and reinforce the correct and consistent use of masks. Students and staff are also reminded not to touch their masks and to wash their hands and use hand sanitizer frequently. Clear masks are not, the clear masks are different from face shields. So our guidance is on page 8 and 9 of our handbook.
Okay. Thank you, A.S. Armstrong, for that clarification. I just wanted to be sure that that was clarified out there to the public.
Board Member Naumu, can I also, Namau, may I also ask Assistant Superintendent Randy Tanaka to also address the issue of masks? Thank you.
Aloha. Board Member Naumu. A little bit of the history on the mask. When we started and we were getting masks from Haima, there were surgical masks, children's size masks, clear masks for the students that needed that, and KN95s. We also got a number of donations of cloth masks, which were all distributed to the schools in the early days. Those were the acceptable forms of masks that went distributed to our schools, kids on buses, every place that we possibly could distribute masks. What has evolved recently is parents in their guidance to their children have provided masks to those children now, and that's where you see the gaiters and those things start showing up. But all our schools are equipped and stocked with the 20-day supplies of the acceptable masks. And we pass them out if the child is not with the appropriate mask or forgets their mask. We have more than ample inventory to provide.
Thank you very much. I appreciate that. Thank you. I have one topic that I want to talk about or ask a question about, and then I have a comment. But I have been contacted by the public about situations regarding immunocompromised Keiki. I mean, these are Keiki that are immunocompromised. They cannot, because they're of their ages, they're below the age of 12, they are in great danger, and they are not safe being face-to-face in our classrooms. These are children also that are looking to have some kind of instruction given to them. They're looking to have distance learning with a teacher, hopefully with peer review as well, but with a teacher. And I realize that distance learning has been an issue and is very difficult. But is there anything that the department can do to assist these particular students that really don't have any choices at all? Is there anything that the department can do to help these Keiki?
Thank you, Board Member Noble. I'm going to ask Assistant Superintendent Heidi Armstrong to respond to your question. Thank you. Yes,
Sure.
Armstrong.
Thank you, and thank you for the question. And yes, students who do have health conditions do have options available to them. And in addition to the distance learning that was just mentioned, we also have our home hospital instruction, which is a plan created for a child with a medical condition. And then that plan would be created specifically for that child and how that child would receive instruction while having the need to remain at home due to their health condition. So it's a home hospital plan, and that is available to those specific students that you were just referring to.
Okay, thank you. I appreciate that. One last thing that I just wanted to say, this is my comment, that I just appreciate the department's efforts in creating distance learning or the opportunity for distance learning for Kula Kaiapuni. I know that at the beginning during the summer that it was just said this was not an option, but as COVID cases have gone up and the situation at the schools has been very disconcerting, and of course it's an equity issue. We have to provide for those students that are in Kula Kaiapuni. So I really do appreciate the department for making those efforts. I know that the Office of Hawaiian Education has been very, very busy trying to make this happen. I also know that one of the reasons it's not able to pop it up as quickly as they would like is that there's a lack of human resources. We don't have enough teachers in the classrooms currently to present to the students in the classrooms now face-to-face, much less having them available for distance learning for the students. And always it's an issue with curriculum, having the abilities for curriculum and the opportunities of curriculum to be presented on distance learning for students in the Kaiapuni programs. So I'm hoping that through this exercise of going through, oh, and also I just wanted to share, Superintendent Hayashi, that I'm sure that with appropriate funding, I have all the faith in Office of Hawaiian Education that they will produce something that's really magnificent for our Kaiapuni children. So I hope that the department continues to provide the resources that are needed to make this happen. And I know that they will make it happen. And I also hope that going through this exercise of distance learning, that it will lead to a longer term solution for what is needed for students in the Kaiapuni programs throughout the state to explore the ideas and issues that maybe they can have a class that is taught on Hawaii Island to students on Maui as well as Oahu and Kauai. So to look at the length and the breadth of all kinds of opportunities here, I'm hoping that the department can build upon this exercise now that you've done, and the opportunity for distance learning to happen in Kaiapuni schools. So mahalo for that. And I yield.
Thank you. Board Member Asher, followed by Board Member Berg. Board Member Asher, we're not hearing you. Your mic is unmuted, but try again. If not, I'll give you some time and we'll go to Board Member Berg. Okay,
Are you able to hear me, Chair?
now I can hear you.
Chair?
Go ahead. Go
Oh,
ahead,
okay,
Board
all right.
Member Asher. I can hear
Okay,
you.
thank you. Thank you. Sorry about that. Before I ask my questions, I just wanted to echo all my fellow board members in thanking the department for all that you guys are putting in to add options for distance learning and trying to make sure that parents and the communities are staying informed with the distance learning and quarantine policies. So my question is really is going to really piggyback off of what Chair Lynn Fallon was asking earlier. Um, with the contracts that are pending for testing, I'm just curious, where are we sending our kids to once when a student show up and they're showing symptom, and I guess they go to the health room? What happens after for testing purposes? And then when we identify close contacts, where do we refer them to? I know a situation where they had to go and wait at the airport, and the line there is just really crazy. And I wonder if there are other alternatives that I am not aware of, so we can help share that information out. So really that question is about where is the school sending our kids to for testing? And then the second one is, are there now designated staffs to answer questions about quarantine and distance learning questions, or are they calling and getting sent to the general line? I know there are members in the community that are saying that they're still having difficulties contacting schools and having a timely response. And during the time of wait, their student is not in class, whether it's especially because they're sent home. So they have not picked up a device. Their student is not in class, and it's over 24 hours that they haven't heard anything. So I wanted to know, like, what are the options for parents to contact the schools and know what to do next? And really transitioning from that question is my last one. Are the schools having like one-sheeters to guide parents and students on what to do if the student is tested positive and or if a student got a close contact. I know that the schools are really busy. I cannot even imagine how hardworking and busy everyone is. And I'm just thinking that maybe if there is some kind of simplified version of knowing, kind of guiding parents on what to do, what to expect when their kids are tested positive or have been called and told that their kid may have, been exposed, then what to do after. So those are really my questions. It's testing, whether there are designated point of contact relating to distance learning and or quarantining questions. And then the last one is whether there are like simplified one-sheeters, infographic kind of thing to give parents some kind of mapping or guide on once they're in this situation, especially with the numbers, with the variants, and unfortunately, we might be in this situation for a while. Thank you.
Okay, I will turn that question over to A.S. Armstrong. A.S. Armstrong?
Thank you, and thank you for that question. And so when a child does become sick at school, the child goes to the health room, and if they must wait for pickup, the schools have all identified an isolation area to separate anyone who has COVID-like symptoms, and all schools have identified that area. Once the parent picks up the child, they are given, it's called a return to school work criteria sheet, and it is a one-pager, and it does share information to the parent of what the steps are to follow and when the child would be cleared or the conditions that must be met in order for the child to return back to school. For questions regarding quarantine or even questions regarding the illness, etc., we do have the resource of the Hawaii Keiki hotline, and parents can call that number at any time and ask any general questions regarding the symptoms, the quarantine, what does it mean? And so that hotline is staffed by RNs or APRNs who are highly qualified to walk the parent through any health concern questions that they may have.
Thank you very much for that response, A.S. Armstrong. It's very helpful. Thank you so much.
Thank you.
Before we move to Lila Berg and Kyla, A.S. Armstrong, could I just ask as a follow-up to Board Member Asher, do the nurses have language or interpreting capabilities if the parent is not fluent in English?
Yes, they do. Yes, if they call the hotline, we have translations. I think it's in the 16 languages. So that capability is there, definitely.
Thank you. That's very good to know. Board Member Berg, followed by Student Rep Kyla.
Thank you, Chair. And Keith and Phyllis, so nice, not nice. Thank you for being here in with such a calm temperament. This is my first board meeting, and I have to say, honestly, I'm very, very overwhelmed. And so I have a question, one question to ask. How is the public getting the information that you're sharing with us? Because I think it would help them understand that the DOE is doing something, that the BOE is paying attention. You know, I know that from being at the school level, sometimes we get a little skittish to put something out in public because it can always be misinterpreted or misread. And kind of twisted around. But, you know, what you've shared reassures me that there are efforts going on. Not that I doubted it. At the same time, it's very reassuring to hear from you directly. So how is this information getting to the public, or at least to the parents of specific schools?
Thank you, Member Berg, and welcome. There are several ways that we are communicating with parents and with our community, and our school staff. We do send parent letters, both from the department and from schools. There's definitely social media, and our DOE website, hawaiipublicschools.org, has pretty much all of the information that we shared. There's news releases that we do put out from the department, as well as newsletters. The Department of Health also has a website. Hawaii COVID-19 is also has information about general health related to community, as well as school websites and the media. Thank you.
Yes, and thank you for that. And question relative to that. How might we as a board assist in getting the communication out and the information out? I really don't want to welcome hundreds of people contacting me individually. How might we be supportive of information, specific information sharing, even the idea of or sharing the 3 days, you know, for the testing results to come back? Because I'm sure that will upset people, since perhaps they've been tested and it's taken them, you know, a day to get the information. How might we assist?
Thank you very much for that question, Member Berg. I think to help all of us in working together, it's really important that you help us to continue to get the correct information out, to our communities and to our parents and to our schools. And so that definitely is important, that the correct information is being sent out, as well as I think it would be great if if board members are interested and they would like to visit schools, to actually see the things that are going on in terms of mitigation strategies and so forth. That can be definitely arranged through the board office, through our area superintendents, to visit whichever schools you want to visit. That definitely can be arranged. And and then perhaps to share what your experiences at the school, in talking with students and teachers and school level administrators, as well as our classified staff. I think everyone is working really hard, and I know you all know that, but it's also good to go to the schools and to see. I've been really, as I shared earlier in the SAC committee, I've been really fortunate to go and visit schools on the different islands. And one thing that I see that is consistent is the hard work and the implementation of the mitigation strategies, that's happening at the school. So we do invite you, to join us, and and continue to do all that you do to support us, all of us, and the schools and everyone in all that we do in this very difficult time. Thank you very much.
Yes, and I appreciate the suggestion. I rarely even leave my front gate, so I'm not. For me personally, I love the school, being at the school. It certainly is an option. Thank you. Perhaps that's a conversation we can have among ourselves, in terms of how to share specific information. We support you emotionally, of course. But the information that I heard today in the last hour, some of my acquaintances who are raising their grandchildren are unaware, and they're deeply engaged, you know, in the daily learning of their kids. So I'm just looking at how, not just work together, I'm looking at specific ideas on how information can be accurately communicated so parents don't feel so helpless. And perhaps you folks can think about some specifics and come back with us also at the next meeting or before then.
Thank you very much. We'll do that and share back at our October meeting. Thank you.
Thanks, Keith.
Board Member Kayla, student representative.
Thank you, Chair Payne. Aloha, Superintendent Hayashi. I know there has been a rising concern surrounding learning loss, and it has continued to come up due to students being pulled out of school for quarantine procedures. And I just wanted to ask, when a student returns back to school from quarantining, is there data information being collected regarding student experiences during their quarantine, either through some type of confidential questionnaire or survey that is issued by individual schools to sort of gauge how students and or parents felt during their time away from school? For example, if they felt like they were being supported enough and what kind of specific measures that their school took to achieve that, or the opposite, if they felt like they were extremely behind and lacking in material and what they kind of wish that they would have seen from their school to help better their learning. So I was just wondering if the DOE was collecting data on that.
Student member Muso, that is an outstanding idea. We currently, as a system, are not collecting that information. Individual schools may be, not that I'm aware of though, but that is a great idea. You know, for us to get feedback from the voice of students in how we're doing, whether we're doing things well or we have areas to improve in. We'll definitely get something going with that so that we can collect that information. Thank you very much for that suggestion. Appreciate it.
Oh, mahalo. As a student representative, I know I have my limits with what I ask students, so possibly this system-wide type of questionnaire could help us further gauge what we can do for the future. So thank you so much for your feedback.
Thank you.
Board Member Bakarse.
Aloha nui. Mahalo, Superintendent, for your invitation to come and visit the classrooms. I must say that our CASIS here on Hawaii Island has been very welcoming and opening to make sure those happen. And I look forward to rescheduling our meeting the next time here on the office to on the island to to visit schools. Mahalo to my fellow board members. Most of my questions and concerns have been has been addressed and at least asked, although not all answered. So I have just a couple of things to add. Basically a question and a request. So first off, for the request, mahalo for this update that you folks have prepared. I'm looking forward to many more to come and seeing marked progress as we get these updates. So regarding the updates, if you could in the future include more data and dialogue so that as we look through this, we can better understand where you're at, some of the things that you'll be sharing, and we can better prepare our questions and comments. Distance learning, for example, distance learning for immersion schools has been something that I've been hearing a lot about in my circles. And when I opened up the presentation to see what was going to be shared, I just saw two pictures. Same kind of went on for the update on the on-campus testing. So the request is to provide more dialogue and data as you send out the pre-information so that we're better prepared. Now, the question has to do as well with the distance learning options for immersion schools. We're really grateful that there are options that are being provided, and being that the immersion school community is much smaller, and that even during distance learning, connection to other students and other people is definitely important. My wondering is are there any plans to connect with our immersion charter schools and to create distance learning opportunities through them, as OHE is working to create distance opportunities for our DOE immersion schools? So that would be the question. Mahalo.
Thank you. I'll turn it over to Deputy Superintendent Unibasami. Thank you. Deputy.
Aloha, Board Member Bakarsi. I do know that the Office of Hawaiian Education has reached out to Hawaiian focused charter schools to have conversations, to invite collaboration, whether it's around practices or curricular or instructional practices. And that's not just because of COVID. I think that's something that they do on an ongoing basis. But I know that specifically as we were looking at distance learning opportunities and what are some things that we could do online that were what we call shovel ready. In other words, we could use it right away. There was a reach out for a sharing, collaboration and sharing, and some of them have responded. So, and we are grateful for that. Thank you.
Mahalo nui. I look forward to future updates, and I'll be also reaching out to some of our immersion schools and charters to see, maybe push them to really work together and collaborate, because this is a great opportunity here. Mahalo nui. And other than that, I don't have an additional question at this time, but just wanted to reiterate my request to get more information when we get further updates in the future. Mahalo. I yield the floor.
Thank you, Board Member Bakarsi. Are there any other comments or questions from board members? Be a moment. Okay. Seeing none, we will move on. This is not an action item, so we are now moving on to the last item on our agenda, which is late public testimony. And we do give members of the public an opportunity, if they missed their opportunity to testify earlier on agenda items, to testify now, or if they signed up and weren't in attendance, or if they had technical difficulties, or if they signed up late. Do we have any testifiers who've signed up to provide oral testimony?
Yes, Chair. Linda Elento. Agenda item 3B, Student Achievement Committee Report. Linda, can you hear me?
Yes, I can hear you.
You have 2 minutes. Please proceed.
Okay, thank you very much. I just wanted to point out a question that I've actually had in the past, but this was the first time I've actually seen a good example in the presentation letter. Let me just pull it up again real quick. The one regarding the presentation, let's see, for the department's educational plan for the use of the funds, ESSER funds. On page 1, under background, there's a reference to the our state being a unitary SEA LEA and how the funds are being distributed. So when the federal government gives out any funding, it might designate a percentage to SEA versus LEA. Well, I just question the way the percentages are distributed, because it does require someone to decide what gets priority here. And I'll just end with this, an example for the percentages. If the LEA is required to use 20% of the learning to address learning loss, and the examples given had to do with like after school activities and programs and so forth, why is this particular report on page 1 referencing the SEA minimums of 1% on the examples given here? For me, 20% of 90% wouldn't be accurate. It would be 20% of 100% that the LEA, which is the DOE, 20% would be required to be used on those type of learning loss examples. So I know I may not have explained it quite clearly, but I think this is an ongoing question that I think should be explained and determined how that's.
Rebecca Hadley Schlosser, followed by Lorraine Yoshida, Kalania Kale Wilson, Vicky Cam, Burke Burnett, Lucy Herzog. Rebecca Hadley Schlosser, Agenda Item 5A, update on opening of schools for the 2021-2022 school year. Rebecca, can you hear me?
Yes, I can. Can you hear me?
Yes, you have 2 minutes. Please proceed.
Thank you. Aloha, Chair Payne and members of the Board of Education. I'm a special education teacher at Nanikipona Elementary School and a member of the Hawaii State Teachers Association. I am testifying in support of my colleagues and our school communities in relation to the update on the opening of the school year. As the school year progresses, I'm getting more concerned about how we are going to maintain everyone's safety while remaining fully open and in person. As a person with underlying health conditions, I am anxious and afraid. Burnout is real, and I'm quickly approaching that stage. Retirement is looking very desirable right now. While I don't want to go back to what we did last year in terms of our delivery of instruction, we need to work together with the DOE to determine what is in the best interest of our school communities. With the memorandum of understanding we had last year related to mitigation strategies, we were able to limit the number of cases on campuses across the state. With no MOU related to these strategies now, some schools have revised their guidelines, and as you can see, the number of cases on school campuses are being in the triple digits, and it's very concerning. I don't want to go back to simultaneous teaching, but if that's what it takes to ensure a safe school and safe community for all, I will do it. We need to look at what worked and how we can use that to help us this year. They worked, and what we are doing now is obviously not working. We need clarity on the policies, and the only way to ensure that clarity is to bargain a memorandum of understanding that ensures we will have safe schools and safe communities for students and communities need. Thank you.
Lorraine Yoshida, followed by Kalania Kale Wilson, Vicky Cam, Burke Burnett, Lucy Herzog. Lorraine Yoshida is not logged in or connected, Chair Payne. Moving on to the next one. Kalania Kale Wilson, Vicky Cam, Burke Burnett, Lucy Herzog. Kalania Kale Wilson is not logged in or connected. Moving on. Vicky Cam. Vicky Cam is not logged on or connected. Next. Burke Burnett, followed by Lucy Herzog. Catherine Mataval. Burke, can you hear me?
Yes, can you hear me?
Yes, I can. Please proceed. You have 2 minutes.
Thank you. Well, this wasn't what I intended to testify about, but I heard some dangerously wrong information being given earlier on the issue of testing and how long PCR tests take. Quickly, the whole point of surveillance testing is to quickly identify who's ill and so who would be infectious in a classroom. In this respect, rapid antigen tests are superior, and anyone who says otherwise does not know what they're talking about. This is a really important point, and this wasn't what I was intending to testify about, but really there's dangerous information. Please find the correct information before you proceed. So my name is Burke Burnett. I'm the parent of a ninth grader at Kalani High School, who is now in distance learning, and I'm one of the founders of Hawaii for Safe Return to Schools. We are in a new kind of war with COVID, and the DOE is using a mitigation strategy that might have been appropriate with the Wuhan strain, but is radically inadequate to curb transmission of Delta. Delta is an airborne virus that behaves like smoke particles. The virus does not follow a polite 3-foot distance. An unmasked or imperfectly masked infectious person will quickly fill an entire room with virus particles, and everyone in that room, unless it's very well ventilated or filtered, who is not properly mask exposed, will be exposed. But under DOE definitions of close contact, only those within a 3-foot distance lasting longer than 15 minutes are considered potentially exposed. Therefore, when persons outside of that definition get sick from a classroom exposure, but were outside the close contact definition, the DOE simply declares that sick person was not infected in a classroom. The DOE is using dystopian bureaucratic logic to define exposure out of existence. I urge you to make unannounced visits to several schools to see conditions for yourselves without the ability for DOE to stage manage your visits in order to pull the wool over your eyes as to what is really happening on campuses. You don't work for DOE board. It is your responsibility to exercise your fiduciary responsibilities to ground truth their claims. Otherwise, you will be complicit in what is clearly a manifestly unsafe school reopening. Please do your job, board. Mahalo.
Lucy Herzog, followed by Catherine Mataval. Brian Costa, Cara Flores. Lucy Herzog. Chair Payne, Lucy Herzog is not logged in nor connected. Moving on. Catherine Mataval. Catherine. Chair Payne, Catherine Mataval is not logged on nor connected. Moving on. Brian Costa. Chair Payne, Brian Costa is not logged on nor connected. Cara Flores. Cara, can you hear me?
Yes, can you hear me?
Yes, I can. You have 2 minutes. Please proceed.
Thank you. Multiple experts at this point have said it's not safe for kids to be in school with the current conditions in school. Thankfully, since travel has massively decreased recently, we're seeing a decrease in cases. But the discussion that me and my husband are having almost every night is whether or not we should pull out our kids, all three, and homeschool them. We feel like we're taking a huge risk sending them to school because there's so many holes in the safety policy. The DOE and the state seems to have really failed to recognize what the CDC has been saying for months, that vaccinated people can spread this disease. And vaccinated people, especially teachers who are close contacts, are being told they don't need to test or quarantine because they're vaccinated, as if they can't transmit the virus. Also, there's inconsistent masking at schools. I've been told by a teacher and a sub, that people in the front office or when the kids aren't around, the adults are taking off their mask when hanging out, and there's no one for them to report it to without getting retaliated against. The superintendent testified to the state senate that absences wouldn't be penalized, but I just saw an email from a parent that they are getting penalized and threatened with truancy court for not sending their kid to school when they don't feel it's safe at the moment. Also, people are being penalized for keeping family members home when another family member is sick or exposed, and they're being penalized because that family member hasn't tested positive yet. We need to be paying attention, and the school needs to be doing a better job of getting kids outside. Thankfully, my kids' school is keeping them outside for a lot of their classes under trees, but there's nothing built, no structure in the school for them to go hang out underneath. Thankfully, one of my kids' schools has really old trees that they can utilize. But why haven't we?
Brian Costa, agenda item 5A, update on opening of schools for the school year 2021-2022. Chair Payne, Brian Costa is not logged on nor connected. This concludes late testimony.
Thank you. Since there is no more public testimony or further business on the agenda, this meeting is adjourned as of 4:33 p.m.